Thank you guys for having me. Today, we're going to talk about various different implant materials, but really we're going to focus on biomimetic titanium, and particularly the technology that SpineArt has kind of revolutionized. And we're going to present two clinical studies that we did supporting kind of this technology, and we'll kind of go through what we found. These are my disclosures. The only thing that's kind of significant to this is that I do consulting with SpineArt. So, there's various implant materials in spine surgery, everything from allograft to titanium to porous to acid etched to laser engraved to PEEK, HA coated. And really, we've been kind of searching for the holy grail of implant material for a long time. And it was assumed that we found this with PEEK, given its kind of low modulus of elasticity and its kind of so-called ability to see the fusion on X-ray, which I think we can kind of debate that as well. But more recently, I think there's a lot of us that have moved away from PEEK, given its hydrophobic and apoptotic properties on a cellular level. I still think that PEEK is probably 50% or more of the implant market. I think more at the education centers, a lot of people have been moving more toward titanium. The benefits of titanium and porous surface technology in terms of osseointegration is not new, right? This has been around for a long time, particularly in orthopedics. We've used porous titanium for total hip arthroplasty for about 30 years. And it's been used even longer in dentistry. So when I actually looked to kind of see who used the first porous titanium, dentists were using it for implants like 50 years ago. Again, to get these implants, these tooth implants to fuse into the mandible. And when we look at our experience with total hip arthroplasty and these porous cups, you can see that the survivorship for the acetabular component at 10 years is nearly 100%, and things are much better today, right? We know that at 15 or 20 years, these numbers are kind of consistent to what we see today. I want to sidetrack for a minute and make an important difference, which I see at the meetings all the time and confused particularly with industry and the sales representatives in industry, and sometimes even in journals and in everyday conversations. 3D printing is an additive manufacturing process from a CAD, right? Computer-aided design. Porous trabecular biomimetic metal is a different type of technology that may be designed to stimulate both bony on-growth and ingrowth. Can a 3D printer be used to produce something that is biomimetic? Absolutely, like something at the top here. But at the same time, you can use a 3D printer to print essentially anything. That doesn't necessarily mean that we're talking about surface technology or biomimetic technology. TiLife is a technology that was developed by SpineArt, which is a 3D printed porous metal design that is biomimetic and hopes to enhance early and robust osseointegration. And when we look at the structure of trabecular bone, we can see that the pore diameter is usually somewhere around 400 to 600 micrometers, and the porosity is about 80%. And when they designed the TiLife structure, they tried to design it similarly. So pore diameter, again, 600 to 700 microns, and overall porosity around 75%. One of the beauties of PEEK was that its modulus of elasticity was somewhere between cancellous bone and cortical bone, but much closer to cancellous bone. And subsidence, we think, has a lot to do with the the modulus of elasticity and that difference between trabecular bone and the implant itself. Modulus is this, as we know, is the slope of the stress strain curve, but it could also play a role in something called mechanotransduction, which we'll touch on a little bit later. The things that we really also need to know is that, and realize is that modulus is not everything, right? So some of the failures of the porous implants that we've seen in the literature, some of the early tritanium cages, the tantalum cages. So tantalum cages were used in ACDFs and a couple of trials for anterior cervical fusion. And what happened with those was because they didn't provide enough compressive strength, there was an increased risk of catastrophic failure. So at the same time as we want to have the optimum modulus, we need to make sure that there is enough compressive strength to prevent catastrophic failure. And what you can see here is that even though that the modulus is very close to peak, the compression strength is relatively strong, about 10 times stronger. So the kind of the basis of the talk that I wanted to give to you guys today is an overview of two of the studies that we did surrounding TiLife itself. And these studies, again, are using TiLife specific technology, but likely the data can be extrapolated for any biomimetic trabecular type of metal. Now, these studies, again, were used specific with fine arts technology, but as you'll kind of see as we get through, I think really the idea is trabecular biomimetic metal versus 2D titanium, traditional titanium versus PEEK. And what we wanted to do was have a comprehensive, robust analysis of this, both in vitro and in vivo, to see if our hypotheses were correct. So there are two studies that were performed in 2019. One was an in vitro study, and the second study was an animal study in sheep. So on a cellular and chemical level, how does the structure of TiLife alone affect osteoprogenitor cells, right? This is really interesting. Can just the structure of a metal change proliferation, morphology, and gene expression in cells, right? No other additives at all, just the actual structure of the material itself. And that's what we wanted to see in the in vitro study. So again, what was the objective of the study? The objective was to determine if stem cells receive kind of signals from the surface to become or go down the lineage of osteoprogenitor cells. The cells were cultured for 42 days on different media, and we'll go through this. And we looked at cellular morphology, cellular proliferation, and osteoblastic differentiation. So this is the basis of the study. Cells were harvested from human bone marrow, and then aliquots of stem cells were placed on PEEK chips, machined two-dimensional titanium chips, and TiLife chips. And they were placed on and analyzed at 7-day intervals from 0 to 42 days. When you look at the TiLife technology on scanning electron microscopy, at 200 microns, you can see the trabecular nature of the metal. And if you look really closely, you can see this surface roughness that is purported to improve osteointegration. So these are the results for our PEEK group. So at day 1, this is the aliquot of cells that were mesenchymal stem cells that were placed on the PEEK or plastic disc. And as you can see at day 7, it forms this relative confluent layer, but sometime between day 7 and day 14, the layer starts to break and it fragments and the cells become detached from the actual PEEK itself. So there's something about cellular adherence to PEEK that early on, there may be some dispersion, but later there is no significant integration of the cells with the plastic itself. When we look at the scanning electron microscopy for two-dimensional titanium, we see a similar type of thing. At day 7, you see a confluent organization of cells, but then somewhere between day 7, day 14, day 20, the cells begin to pellet in the center, and then day 42, the pellet that remains in the center starts to proliferate, but everything on the side doesn't. So there's some cells that remain attached to the titanium. There's probably a few, and those are proliferating, but most of the cellular attachments had been disengaged by day 42. And then when you look at three-dimensional titanium, and this is the TiLife technology, you can see early elongation of the cells at day 7. So these are the cells, and you can see elongation of extracellular matrix. But at day 28 and day 42, the layer of cells that remains attached to the metal itself is so dense that it's really impossible to distinguish the cells themselves from the extracellular matrix that they deposited. And this is a really interesting slide that shows the scanning electron microscopy after 48 hours of inoculation of the stem cells on the TiLife technology. And what you can see is that these dots are the cells, and these big globes are kind of the metal struts. And what you can see is that there is extracellular matrix already that's extending between the metal that's being excreted by these cells as early as 2 days after deposition of the cells. So there's early cell-to-cell communication in addition to adherence on this type of trabecular biomimetic metal. These are slides of cytoskeleton that were tagged with, I think this was cyber green. It may have been Phalloidian. I think it's cyber green though, but basically it was the cytoskeleton, or the actin was tagged with a fluorescent marker. And you can see the blue dots are, as always, are nuclei. And at day 7 on the TiLife, you can see that there's early cytoskeleton formation. And then as we progress from day 28 to day 42, there's increased cytoskeleton changes, and there's complexity, and there's remodeling. And this remodeling and complexity is really directly proportional to cell-to-cell communication and mechanotransduction that's occurring. This is really not dissimilar to kind of like a fiber optic network that you'd see between cells. This is the results of the cellular proliferation part of the in vitro study. So we looked at what was the number of cells and how did those proliferate at different time points, at time point 0, 7, 14, 21, 28, and 42. And what you can see is that at day 42, the 3D printed biomimetic titanium had the highest number of cellular proliferation. So there's something in the metal that is not only changing the structure of the cell at this point, not only changing the morphology of the cell and the deposition of extracellular matrix, but it's also inducing cellular proliferation more to an extent more than traditional titanium or PEEK. The calcium content of the cell culture was looked at as a potential predictor of biomineralization. What we can see here is that the calcium content at day 42 may be slightly higher than the other implants. This is a little bit confusing for me because given the fact that there's a higher number of differentiated cells that's in the TiLife sample, it's really hard to tell if this is truly an increased calcium content or an increase that's a result to the increased number of differentiated cells. So I kind of hold a little bit of weight in this. This is alkalinephosphatase activity. Alkalinephosphatase activity, this cell is normalized to protein content. So it takes out the amount of cells, and it's normalized to that. So it's normalized for the cell number. And what we find is alkaline phosphatase, as everybody knows, is a membrane-bound protein, which is very specific to the osteoblast. And it's released during times of osteoblastic proliferation. So what does that mean for us in this? It means as we started with stem cells, and this is an enzyme that's found in osteoblasts, this is kind of giving us a hint that these stem cells are going down an osteoblastic lineage. So this is saying, is there something on the three-dimensional titanium biomimetic structure that's actually driving cells from a stem cell down the osteoblastic lineage. And what we see at day 42 is that there is significantly more osteoblastic differentiation in the 3D printed titanium TiLife biomimetic technology compared to traditional plastic PEEK and two-dimensional titanium. So this is really interesting, right? So there is something about structure alone, not graft, not additional media, just the structure alone. There's something about this biomimetic structure that can change cell morphology, can induce proliferation, and may be able to drive stem cells down an osteoblastic lineage. You know, as clinicians like we are here in the room, the next question is, well, it's great in a test tube, but what does it mean for me? And does this work in vivo? And that was our next question too. And we looked at the fusion in an animal model where we used sheep. And we took 8 sheep that were randomly implanted at the L2, 3, and the L4, 5 levels. Okay, so there's each sheep was implanted with both cages, and I'm going to tell you kind of what's going on. What we looked at was a TiLife Technology cage without any bone graft at all, and we compared that to a PEEK cage with autologous iliac crest bone graft, right? So a PEEK cage with the gold standard bone graft that we have, right? That shows equivalency to BMP versus a TiLife cage with no graft at all, no DBM, no other allograft, no autograft, just the cage itself. So kind of looking at how does the structure of the cage itself lead to in vivo fusion compared to what is considered relatively gold standard, at least in the 90s, I mean, at least in the 2000s and 2010s of PEEK plus autologous iliac crest bone graft. And, you know, when we look in the literature, this is one of relatively few studies and that I could find that actually looked at a cage without any graft. So kind of really looking at how does this structure change in vivo fusion conditions. And we looked at, we analyzed the behavior of bone contact with TiLife versus PEEK. We looked at time points 4 and 8 weeks. The literature standard, I think, is 8 and 16 weeks, but we looked at early osseointegration on CT scan, MicroCT, and histology at both of those time points. Unfortunately, the animals underwent sedation, obviously, for their scans at 4 weeks, and one of the animals passed away. So we were left with 7 animals. So even though the study started with 8 sheep, the final results were in 7. So if you see that, that's kind of what happened during it. A standard traditional retroperitoneal approach was performed, and essentially an A-lift, O-lift type of interbody fusion was used for the study. And again, one group was this PEEK cage with autologous iliac crest bone graft that was obtained at the time of the surgery. And the second was the TiLife cage with no bone graft at all. When we look at the MicroCT results of PEEK at 8 weeks, what you can see is, this is one of the end plates here. This is another one of the end plates here. You can see that there's still some fragments of the iliac crest bone, but there's actually no integration of bone across the cage or around the cage. And if you look at the bottom right, this is kind of a remarkable picture. You can actually see that there's relative osteolysis around the cage, and really no evidence of fusion or even early fusion at 8 weeks. Now, when you look at the TiLife technology or this biomimetic technology, you can see that, again, there's not complete fusion through the cage yet, but you do see that there is bone that's forming already at 8 weeks and starting to traverse through the cage itself. And when you look at the bone the microstructure of the bone, you could see that it's actually integrating in these pores relatively robustly on both sides of the cage. So, there's early spot welding, which can lead to early stability for patients that we could see already at 8 weeks after the on the MicroCT. Now, this is a remarkable slide too. This is actually a CT scan at 8 weeks. You can see the peak that is implanted here, and you can see the TiLife 3D printed technology. Again, this is peak plus iliac crest bone graft, and you can see there's relative resorption of the bone graft itself and osteolysis. And what you can see around the TiLife technology is that there's relative robust bone formation both through the cage, behind the cage, and ventral to the cage. So there's something about this technology that is causing profoundly more bone formation than we would see with peak plus our gold standard allograft. This is a post-mortem histologic specimen for the TiLife technology. And again, we haven't kind of looked at these since medical school, unless you read a lot of basic science journals. But, in kind of a brief review, is this dark purple stuff that you see is immature woven bone. This pink trabecular stuff here is mature bone, lamellar bone. And then this hyaline type stuff in the middle here is cartilage formation. It's kind of that pinkish, purplish, relatively low number of nuclei in the middle is cartilage. So what we see here is that in between the cage, so this is end plate up here, this is end plate down here, and this is in between the cage. In between the cage, we are seeing some sort of end chondral ossification. The end chondral ossification means that the bone is formed through a cartilaginous precursor. So in between the cage, we are seeing some early evidence of end chondral bone formation. Again, this is without any bone graft at all that's occurring through the cage itself. And if you look at the early Bowden studies from the 90s about how fusion occurs, we don't necessarily know 100% how biological fusion does occur. We think that it's actually a combination. It's not just intramembranous, it's not just enchondral. We think that there's a combination of both that's occurring, and that it's a different process than traditional fracture healing that we study in orthopedics. So what we see here is in the center of the cage, we see this enchondral ossification. But if you look on the cage itself, so on the surface of these trabecular pores, you could see this dark purple deposition. That's immature woven bone. There's intramembranous bone formation, so bone that's forming without a cartilaginous precursor. And that's really interesting, right? So we have two types of bone formation that we're seeing that's stimulated just by the metal and the surface itself. This is just looking at things a little bit closer, and you can see this purple is this immature woven bone, and that this pink is the mature lamellar bone. And you can see that there's early osteointegration of immature woven bone and in an intramembranous type of formation on the cage itself. Now, when we look at peak, it's a stark difference, right? This is a really nice picture because you can see that now you don't see really any bone formation around the peak itself. You actually see relative area of maybe apoptosis or fibrous formation. You see this kind of almost shielding of bone formation. And where the graft was placed at 8 weeks, you can see that there's osteolysis essentially of the iliac crest bone graft that was placed between the cage. And some other in vitro studies with peak have been shown that peak itself can induce mesenchymal stem cell apoptosis, and that may be part of what we're seeing here. Again, that's just speculation. We wanted to look at it quantitatively, so we did a quantitative histologic analysis of this, where we subtracted the interbody cage out in yellow here, and the surrounding tissues were measured, discerning those of cartilage versus bone. And what we found was that there was significantly more bone and cartilage in the 3D printed titanium without graft as there was in the PEEK plus allograft, and it was significant in both the cartilage and the bone subgroups. The next thing we looked at was bone implant contact, which I think is important for early osseointegration, kind of this spot welding to the cage to get early stability. And what we found was that, as you could see in the PEEK cage, there was really no bone implant contact at all, but there was significantly more in the 3D printed biomimetic titanium.
Hey, Dr. Laratta,
yes.
Close, how much longer do you take approximately?
About maybe a minute or two.
Okay, sounds good. Thank you.
In conclusion, I think that TiLife shows a much faster and enhanced osteointegration when compared to PEEK plus autologous iliac crest bone graft, even at 4 weeks. This leads to early stability, and this is where we started from. What leads to fusion? Stability, size of implant, delivery of graft. TiLife allows bone graft through the cage, around the cage, while PEEK shows osteolysis when even using autologous iliac bone graft. So kind of what's the take-home message for all this? Well, this is really comprehensive, right? So we looked at in vitro and in vivo for biomimetic titanium. When you mimic trabecular bone structure in terms of modulus, porosity, and roughness, there is likely things that are going on in terms of cellular proliferation, changes in morphology, differentiation into osteoblast, and early integration. And I think what this is leading us to is, can we eventually get to this technology becomes so good that bone graft and biologics are not necessary? This is just kind of disclosures where this was presented and where it is accepted. And I thank you guys for inviting us and to allow us to talk to you about this technology.
So great, Dr. Laratta. Thank you so much. And really cool to hear your basic sciences research. I'm glad that there's new efforts at improving the biomaterials. Now, all honestly, what is the advantage in a 2-sentence response, or 2 or 3 sentence response of this material over allograft, structural allograft? Structural allograft with appropriate graft bed preparation and biomechanical neutralization seems to work pretty well. So why would we use a complex titanium over a proven biologic material?
Yeah, so that's a great question. And I'm glad, and I hope none of your fellows get that question asked to them on their boards either. That was something that I thought when I was taking my boards is, what if the examiners tell me, why are you using cages and not allograft? And I don't think we exactly know the answer yet, but we do think that maybe, again, just like these studies, that there is something about this biomimetic metal with titanium specifically that may be inducing different changes. But we would have to for us to know that, we have to do kind of head-to-head studies of allograft versus titanium. In short, 2 sentences, I trained with Dan Rue at Columbia. I use allograft for ACDFs, right? So I believe in that technology. I still think it's a great technology. And I think that a lot of times we have to be careful with industry, is industry changes how we practice kind of more than the basic science does. But I don't think there's anything wrong with allograft at all.
Great. So then the second question, my second and last question, we have to unfortunately come to a close, is in some of the earlier cases we demonstrated the significant problems of imaging titanium bone interfaces and concluding if there's a true fusion, or what I've labeled a metallusion, something that seems to be okay, but we're not quite sure. And only over time we see increasing subsidence with secondary phenomena like hardware failure in one case. So how can we actually truly identify fusion clinically with imaging tests, et cetera, in the future with these more biologically interactive materials?
Right. So, it's, and that's tough, right? So when I look for fusion on cages, when we're using cages, and this is something that we wrote a paper on out of Columbia as well, there's fusion through the cage and there's fusion around the cage. I take much less, I think that the fusion around the cage is actually more important than the fusion through the cage. And especially when you look at ACDFs and things like that, that's usually where you can kind of see distinct fusion. The problem with metal, like you mentioned, is that they're scattered. these new technologies of biomimetic metal should actually improve our ability to assess fusion on CT scan, because there's much less scatter than there is in regular titanium. So hopefully we can see and assess fusion around the cage and through the cage better, because it has a less dense structure. Now, that being said, like we showed in this, how much fusion is really needed? Can you just spot weld to the cage itself, and is that fine, right? And if you look back at Jeffrey Fishgrunt's studies, with uninstrumented fusion, 45% of uninstrumented fusions that went on to non-union were asymptomatic, right? So I think when we talk about that, what's the effect of spot welding, like you see with kind of SI fusion and SI bone? Is that enough? Or does robust around the cage fusion need to be achieved in every patient? And I think that's still to be determined.
I know you're not a corporate spokesperson. We appreciate SpineArt's support of your lecture today, but do you anticipate there being a premium on this kind of a biomimetic titanium, or is this something that can be kind of offered in a cost competitive fashion towards conventional currently available implants?
I can only tell you my experiences at my institutions, which is one is an academic institution, and then I work at 3 different private hospitals as well as a surgery center. The new biomimetic technology comes in at a higher price point in most of those systems than the other ones.
Okay. Yeah, so this is obviously very compelling, and I really appreciate the beautiful slides you showed, and clearly developing something that can mimic nature better and induce bone healing without complex humoral factors and immunologic responses is desirable. I see a clear role for solid structural grafts beyond allograft in the future. So I really appreciate, on behalf of our viewership from around the globe, you educating us about this and showing and sharing your information.
Thank you, guys. Have a good day.
So thank you, Dr. Laratta, and thank you for all of our viewers today. And with this, we'll conclude today's STED Talk. Have a good day.
You too.
Thanks, guys. Good job. I'm glad you showed that case. Yeah, so yeah, I think